This is Chapter 5, the respiratory system. We are starting on slide 23. The first term up there, pulmonary angiography. Okay, this is radiology of the lungs, so an x-ray of the lungs after injection of a contrast medium. So they inject a contrast medium into the lungs to create this x-ray image. That's pulmonary angiography. Okay, computed tomography, that's a CT scan, and MRI, which is magnetic resonance imaging. Both of these imaging modalities can be used to visualize the respiratory organs. So both of them can be used in diagnosis. A lung scan. A lung scan uses radioactive material to test blood flow or air distribution in the lungs. So it's a radioactive material to test blood flow or air distribution in the lungs. This can be helpful in diagnosing pulmonary embolisms. Pulmonary function tests, or PFTs, okay, these are used to determine the lungs' capacity to exchange oxygen and carbon dioxide. Okay, so determining the lungs' capacity to exchange O2 and CO2, that's what a pulmonary function test is. Okay, so one of the pulmonary function tests we talked about yesterday was spirometry. We had a picture of this, so this should be a review. This is the process of measuring breaths, so max amount of inhale and max amount of exhale. We also talked about oximetry yesterday, so this should be a review. Oximetry is the measurement of blood oxygen saturation. Okay, it's that little clothespin that goes on the finger. Okay, that is oxygen saturation that they're measuring for. All right, next part of the chapter is getting into the diseases and disorders of the respiratory system. So first thing I want to talk about is a deviated septum, okay, or a deviated nasal septum. Okay, this you can see is a shift in that tissue between the nostrils, making them uneven. Okay, this could, if this was a severe deviation, it could cause an obstruction in the nasal passage, in which case that individual would need rhinoplasty or septoplasty to repair. If it does not cause an obstruction, though, rhinoplasty or septoplasty would totally just be cosmetic for looks purposes only. Next, we have a nasal polyp. Okay, here you can see that rounded piece of mucosa that's projecting into the nasal cavity. Okay, that is a nasal polyp. Getting into some of the pathologies that deal with breathing. The first term there is hyperpnea. Hyperpnea is excessive or exaggerated respirations. Okay, excessive or exaggerated respirations. Okay, so there's a lot of them and they're usually deeper. Okay, this is what happens normally when we exercise. Okay, so we exercise and we're sucking wind. Okay, that is hyperpnea. Okay, hypopnea then is breathing in a shallow and slow state. Okay, hypopnea is shallow and slow breathing. Bradypnea, this means slow breathing, and we categorize this by slower than 12 breaths per minute. Okay, that's bradypnea. Tachypnea is breathing faster than 20 breaths per minute. Okay, so tachypnea is fast breathing, and it's more than 20 breaths per minute. Orthopnea. Okay, this is where breathing is difficult except in an upright position. Okay, we have a picture in 2 slides that'll show you what orthopneic position is. Okay, but orthopnea is breathing is difficult except in an upright position. Then we have dyspnea. Dyspnea is difficulty breathing. So orthopnea would be an example of dyspnea. Okay, difficulty breathing. One of the abbreviations a lot of times we see here for this is SOB, shortness of breath. The last term on this slide, dyspneic. Okay, this is the adjective or pertaining to form. So this is pertaining to difficulty breathing. Here we have a picture where you can compare the wavelengths of respiration. So that first one there, you're seeing normal respirations, which we call eupnea. Okay, eupnea is our regular rate of breathing. It should be anywhere from 20 down to 12 breaths per minute. Then we have bradypnea. This is that slow breathing rate. So this is slower than 12 breaths per minute. Then we have tachypnea. This is fast breathing. So this is more than 20 breaths per minute. And then we have hyperpnea. Hyperpnea is that deep, fast breathing, okay, more than 20 breaths per minute. Okay, this is what I said happens when we exercise. So you can see that those breaths are deeper than in tachypnea. Here is that orthopneic position. Okay, so we talked about how orthopnea is difficulty breathing except in an upright position. Okay, this is orthopneic position. Okay, this is the position where breathing is easy for somebody who suffers from orthopnea. Okay, so you can see it's sitting up, slightly leaning forward. That is the best way to open up the airway. Next chunk of breathing pathology is apnea. Apnea means stopping of breathing. Okay, we most commonly talk about apnea with sleep apnea. Okay, sleep apnea is where an individual stops breathing for periods of time while they sleep. Okay, sleep apnea can be central sleep apnea that originates from the failure of stimulation by the nervous system. So the nervous system fails, causing the breathing to stop while they sleep. Sleep apnea can also be obstructive. Obstructive sleep apnea results from the collapse or obstruction of the airway. So there's something blocking the airway, causing them to stop breathing. Cheyne-Stokes respirations, CSR. Okay, this is alternating periods of apnea, so stopping of breathing, and then deep, rapid breathing. Okay, so somebody who has these CSRs stops breathing for a little bit, and then they start breathing again. And when they start breathing again, it's deep, rapid breaths. Okay, these type of breaths is what we say a person that suffers from sleep apnea has. They'll stop breathing for a while, and their body will be like, hey, you're not breathing. So then they have to try and catch up, taking these rapid, deep breaths. Anoxia. Anoxia means an absence or deficiency of oxygen in body tissues. Okay, an absence or deficiency of oxygen in body tissues. Okay, anoxia is more severe than hypoxia, but the term hypoxia is also used to mean oxygen deficiency. Oxygen deficiency. Then we have asphyxia or asphyxiation. Okay, this is caused by insufficient intake of oxygen. Okay, asphyxia can be caused by outside causes. These would be things like drowning, crushing injuries to the chest, or inhaling carbon monoxide can cause asphyxiation. Okay, asphyxiation can also be caused by intrinsic causes. Some things that can happen inside the body that cause asphyxiation are hemorrhaging to the lungs. If a foreign body is stuck somewhere in the lungs, as well as diseases of the airway can cause asphyxiation. Hyperventilation, this means excessive aeration of the lungs. Okay, when we have excessive aeration of the lungs, what commonly happens is it reduces our carbon dioxide levels in the body. Okay, because extra carbon dioxide is being exhaled when we're hyperventilating. And carbon dioxide contributes to acidity. So hyperventilation can cause the body to become more basic. Okay, and we call that transient alkalosis. Okay, transient alkalosis is a period of brief duration where the body's blood is more basic or alkaline than normal. So alkalosis is an alkaline condition. Alkalosis is an alkaline condition. Acid-base balance. Okay, the state of equilibrium of the blood's pH is called acid-base balance. Okay, so state of equilibrium of blood pH is called acid-base balance. Now, pH is measured on a scale of 0 to 14, where 7 is neutral, below 7 is acidic, and above 7 is alkaline. Normal pH of body fluids is 7.35 to 7.45. So our body fluids are normally slightly alkaline. Alkalemia is increased alkalinity of blood. Acidosis is a acidic condition. Okay, an acidic condition. And then acidemia is where our blood's pH would be below 7 or more acidic. Okay, it would be a blood condition where it's more acidic. So normal is 7.35. Okay, to be categorized as acidemia, it would have to be below 7.35. Next, we have the term hypercapnia. Hypercapnia means greater than normal amounts of carbon dioxide in the blood. We talked about on the last slide how carbon dioxide contributes to acidity of the blood. So hypercapnia lowers the blood pH level. Hypoventilation means below normal aeration of the lungs. Okay, hypoventilation results in hypercapnia. So hypoventilation causes hypercapnia. Then we have hypocapnia. Okay, this would be below normal levels of carbon dioxide in the blood. Okay, with this hyperventilation would cause hypocapnia. Acapenia is used as a synonym for hypocapnia, so it means the same thing. Then we have hypoxemia. Hypoxemia is decreased oxygen in the blood. And the opposite of that then would be hyperoxemia, and this is increased oxygen content of the blood. All right. Next, we have acute respiratory failure. Okay, acute respiratory failure is a sudden inability of the lungs to maintain normal respiratory function. Okay, so this is where the lungs suddenly are no longer able to function like they're supposed to. Acute or adult respiratory distress syndrome is severe pulmonary congestion, where there is respiratory insufficiency and hypoxemia. If acute or adult respiratory distress syndrome is not treated or doesn't go away, it can lead to acute respiratory failure. Then we have phrenodynia. Okay, this is a painful diaphragm. Okay, here your pain in the diaphragm. Phrenoplagia. This is paralysis of the diaphragm. And phrenoptosis is prolapsed or downward displacement of the diaphragm. Next, we have some abnormalities of the upper respiratory system. Okay, upper airway obstruction can lead to respiratory arrest if it's not corrected. Okay, so this would be a blockage, an obstruction. Respiratory arrest is the stopping of breathing. The stopping of breathing. Coryza. Coryza means profuse discharge from the nose. Okay, coryza is like a really bad runny nose. Rhinorrhea is discharge from the nose. Okay, again, runny nose. Rhinorrhagia. Rhinorrhagia means profuse bleeding from the nose. Okay, so this is a nosebleed. Okay, the medical term for nosebleed is epistaxis. Okay, so epistaxis is a nosebleed. Last two terms that we'll talk about today, we have rhinolith. Rhinolith is a calculus or stone in the nose. When somebody has a calculus or stone present in the nose, we call this rhinolithasis. That's the presence of nasal stones. All right, so that was slides 23 through 34. The end.